is Dr. Rezi, and this is the fourth lecture in the acute pancreatitis lecture, critical care MRCS Part B station. Okay, and we are still talking about the scores, scores that will show us the severity, the prognosis, and the mortality of the disease. So the examiner will ask you, he asked you before in the last lecture, as you remember, that do you know any other systems? You told Ransons, Apache 2, and so on. So he will ask you to talk about anyone, and I told you that you want to talk about the Ransons because they are so close to the Glasgow. Okay, and you remember the Glasgow, as I told you before, from the abbreviation of the pancreas, the letters in the word pancreas. Okay, so the Ransons is good because it measures the situation on admission, and it measures the situation after 48 hours. Okay, so we will take the criteria for on admission first. Okay. And on admission, what are you going to calculate here? Number one, you are going to calculate age, and as before in Glasgow, if more than 55, this is not good. Total WBCs or total leukocytes, there they are in Glasgow, they are more than 15,000. Here, if they are more than 16,000, this is a bad indicator. You will measure the glucose. If it is more than 11, it is 10 there in Glasgow, and you are going to measure the LDH, okay, and the AST. LDH is measured there, it is 600 there. Here, if it is on admission more than 350, or if the AST is more than 200, this is a bad indicator. Okay, these are the criteria that you are seeking for on admission. So after 48 hours, okay, you are going to check what? Number one, you are going to check the base deficit. Okay, and the base deficit, if it is more than 4, this is bad. Okay, you are checking the BUN, and if it is more than 5 moles per liters, this is a bad indicator. Calcium, if it is low, as we mentioned before in the Glasgow, less than 2, this is not a good indicator, and you are going to mention fluid sequestration. Okay, I don't know how can you measure it accurately, but if it is more than 6 liters because of the loss in the third space, if it is more than 6 liters, this severe dehydration. Okay, and you are going to mention the hematocrit. Okay, the hematocrit fall. If the hematocrit fall is more than 10%, this is a bad indicator also. And finally, if the oxygen is less than 60 millimeter mercury, or it is less than 8 kPa, as in Glasgow, is a bad indicator. So this is the Ransons that you are going to mention here. Okay, now he is going to ask you a direct question about the Balthazar. The Balthazar, and the Balthazar is a CT scoring system. So he will ask you about the Balthazar CT scoring system, and CT is the keyword here. You are going to tell him that the Balthazar CT will tell you many things. Will tell you if there is any edema around the on the pancreas, if there is any fluid collection, necrosis, extrapancreatic Yankees, all that is good. But the most important thing are the classes, are the classifications in this Balthazar CT scoring system. It is classified into 5 classes: A, B, C, D, and E. Okay, so A is the pancreas is normal on CT, and this is A. So this is an NSL patient. B is the pancreas is enlarged. Okay, fine. C, there is an evidence of inflammation, or maybe in the pancreas or the peripancreatic fat, but there is an inflammation, evidence of inflammation or inflammatory change. Okay. D, in D you will find a single. Here you will find single in D, and here you will find multiple or more than one, but both are the same. You will find an ill-defined peripancreatic collection, peripancreatic fluid collection. So there is collection. It could be a collection of fluid, it could be a collection of pancreatic secretion, it could be inflammatory collection, it could be anything. Anyway, on the CT you will find a fluid collection. If it is one, this class is D. If it is more than one, it is class E. This is the Balthazar CT scoring system. Okay. Now he's going to ask you some questions about the investigations, interfering with the investigations, but we are going to discuss this in a separate session. Okay.